Breaking news tonight, the new stay-at-home orders as cases surge past 200,000 in the U.S., the death toll rising toward 5,000. Deaths in New York alone soaring 25% in 24 hours. National stockpile, new reporting that those reserves of masks, gloves, and other personal protective equipment have almost run out. Residents now in 39 states and Washington, D.C. under orders to stay inside. The country tonight coming to grips with a grim prognosis as we approach what could be our darkest chapter in all of this.
Facing a grim new reality, the White House projects in just weeks, more than 2,200 Americans could die each day from the virus, with up to 240,000 lives lost if every precaution is taken. States that ordered residents to stay home early faring better than those who didn't. Tonight, our nation already exhausted by a fight that has just begun.
While social distancing appears to be working in cities like Los Angeles, in this county alone, there were more than 1,000 new cases in just 2 days. A big concern is the homeless population.
In New York State, the number of COVID-19 deaths jumped 25% in just 24 hours. And Governor Andrew Cuomo now says the peak likely won't come until the end of April.
How reckless and irresponsible and selfish for people not to do it on their own. Who else has to die for you to understand you have a responsibility in this?
On the front lines, exhaustion. And right in the middle of typically bustling Manhattan, many hospitals now have this, a refrigerated truck, a temporary morgue.
Like governors are apparently forced to compete with each other and the federal government to buy what they desperately need.
The Washington Post reporting the national stockpile of personal protective equipment is nearly empty, despite assurances from the White House.
So you have 50 states competing to buy the same item. It's like being on eBay with 50 other states bidding on a ventilator.
The CDC now says the virus can remain airborne for 2 to 3 hours. It can remain on cardboard for 24 hours and plastic and stainless steel for 2 to 3 days.
Scramble to keep up with the unprecedented surge of unemployment claims. Bills are still due. So call your lender about payment programs and ask for help if you need it.
Breaking news tonight, coronavirus cases surging to over 1 million worldwide. And the staggering toll, roughly 1,000 people now dying per day in the U.S. President Trump calling governors who are pleading for more supplies complainers. A record-shattering 6.6 million Americans filing for unemployment just last week. Small businesses suffering, how to get that rescue money from the government. And new reporting on those relief checks for Americans, why some may have to wait months.
6 days of ventilators in our stockpiles.
Some have insatiable appetites and are never satisfied, he tweeted. The complainers should have been stocked up and ready long before this crisis hit. New York City paramedics are no longer taking patients to hospitals unless they have a pulse. Statistics show the poorest neighborhoods have been hit hardest.
FEMA has requested 100,000 body bags from the Department of Defense. All state residents are being encouraged to wear homemade face coverings when in public.
With 6.6 million people filing in the last week alone.
About double the week before, totaling a stunning 10 million in just 2 weeks. Compare that to claims filed over the past 50 years, including more than 650,000 a week at the peak of the Great Recession.
Through the Paycheck Protection Program, businesses with 500 or fewer employees can apply for the loan offered through their existing banks or approved lenders. Repayment will be forgiven if all employees continue to be paid.
Staff are wearing one gown for a whole 8-hour shift, sometimes wearing rain ponchos or beautician gowns.
More than 250,000 coronavirus cases recorded in the U.S. In New York, the deadliest day so far. Over 500 deaths in 24 hours. Nurses protesting in the street. The major change in guidance. The CDC now recommending all Americans wear face coverings amid new concerns the virus can spread just by talking. More people have died in New York in the last day than in nearly the whole of March. The state's death toll doubling since Tuesday to more than 3,000. And tonight, new hotspots erupting across the country with still no national strategy or unified defense plan.
We are afraid for our patients. We are afraid for our families. We are afraid for our lives.
Daily suicide mission with a lack of PPE, personal protective equipment.
This is life or death. Every hospital in the state of New York and across the United States
should have the supplies they need.
Governor Andrew Cuomo has now signed an executive order allowing the state and the National Guard to take ventilators and PPE from hospitals that have too much and redistribute them to those who need it most.
Am I willing to deploy the National Guard and inconvenience people for several hundred lives? You're damn right I am.
The death toll today in the tri-state region topped 3,500.
It comes as the virus rapidly spreads. Confirmed cases in this country now surpassing 250,000, with 7,000 dead.
Tonight, the coronavirus task force is now asking all Americans to voluntarily wear non-medical face coverings while out in public. The bold step announced by the president a short time ago.
They can be either purchased online or simply made at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks.
In states like Michigan, Massachusetts, Louisiana, and New Jersey, tens of thousands of new cases are flooding emergency rooms.
It's very hard.
It's set to fine residents $1,000 for failing to comply with social distancing orders.
Tonight, the economic crisis is spiraling. After 10 years of consistent job growth, the U.S. lost more than 700,000 jobs in March. Unemployment rising to 4.4%, the biggest month-to-month uptick since 1975. But that doesn't capture the full magnitude of this crisis. The survey for the March jobs report was taken from the 8th to the 14th. It wasn't until the 19th that these statewide stay-at-home orders started going into effect, shutting down cities and towns across the country, and before scores of companies began layoffs. To survive financially, Fleming needs help from the new federal Paycheck Protection Program.
If we do not get something deferring that loan payment, I will have to have some really tough decisions about what we need to do to continue to shed costs to try and keep the business.
Two of Fleming's banks tell him they weren't ready to open applications when the program launched today, despite assurances from the Treasury Department on the eve of the launch.
As I spoke to all the CEOs yesterday, I've been assured that the banks will be in the process starting tomorrow.
It's more than 1,000 dead in the last 24 hours. The dire warning from the president.
This will be probably the toughest week between this week and next week, and there'll be a lot of death.
In the last 24 hours, more than 1,000 Americans have died of the coronavirus. That is the largest daily death toll worldwide since the outbreak began.
The epicenter of the nation's outbreak reporting more than 113,000 positive cases and at least 3,500 deaths. New York City alone approaching 70,000 cases.
Tonight, as the COVID-19 death toll surpasses 8,000.
It's the Wild West out here.
States say testing troubles persist.
Everything about the tests are very difficult to come by, and there's no federal plan for this. So every state is on their own.
CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So this is voluntary. I don't think I'm going to be doing it.
The federal government has authorized $350 billion in forgivable loans to businesses with fewer than 500 employees and will cover their costs for at least 8 weeks.
And coming as the United States reached another staggering milestone, over 10,000 deaths, lives we mourn, as we enter a week that health officials say will test us like nothing before.
I hope in the years to come, everyone will be able to take pride in how they responded to this challenge.
And chloroquine, a drug used to treat malaria and lupus, also carries cardiovascular risks. But the president continues to endorse the drug.
I would love to go to a laboratory and spend a couple of years testing something. We don't have time. We don't have 2 hours because there are people dying right now.
There's God's law, and then there's man's law. Me and my household, we put God's law first.
And in Louisiana, a state with one of the highest number of COVID-19 deaths, Pastor Tony Spell says 1,200 people showed up Sunday.
You know that a tiger in the Bronx Zoo got the virus. It led a lot of us to wonder, does that mean our pets are vulnerable too?
With New York hospitals pushed to the brink, the state's coronavirus death toll had its largest single-day spike yet. 731 people died in just 24 hours. One about every 2 minutes.
It took roughly a month for our national death toll to reach 5,000, but in less than 5 days, that number doubled, now surpassing 10,000. In Chicago, 68% of the city's deaths involve African Americans, who make up just 30% of the population.
After the chaotic rollout of the government's $350 billion Paycheck Protection Program, despite continued reassurances from the Treasury Department.
You get the money, you'll get it the same day. If you don't get the loan this week, there'll be plenty of money for you next week.
Of the 4 biggest banks, 3 received loan applications for more than $90 billion. But so far, they've distributed little to no money. Wells Fargo stopped accepting applications 48 hours after it started. And as of today, Citibank's online application process hadn't yet gone live. The Treasury Department says $75 billion in guaranteed loans were processed, some through community banks.
It would mean that you're no longer contagious and you can't catch the virus because you have the antibodies in your system, which means you can get to work, you can go back to school, you can do whatever you want.
The UK ordered 4 million antibody test kits and found them to be unreliable. Germany is considering issuing work permits to people who test positive for the antibodies, but that could be months away.
There's no silver lining to be found in 14,000 lives lost in this country. Only the hope that these will be the worst days we will see.
Coronavirus killing at least 779 people in 24 hours. The pandemic's deadliest day again.
Remdesivir is one of 10 potential coronavirus treatments in clinical trials right now. Another 15 are in development.
Over 16,000 now dead across America. New York alone with more cases than any country in the world. The state again reporting its deadliest day. Nearly 800 lives lost in 24 hours. Another 2,000 lives lost nationally since yesterday as this wildfire of misery rapidly burns across the country.
Far more than 7,000 have been lost in New York State alone. For perspective, less than 3,000 were killed on 9/11.
With the same randomness, the same evil that we saw on 9/11.
At a city cemetery, workers in protective gear are now burying nearly 5 times more unclaimed bodies a week.
The Cook County Jail in Chicago is believed to be the nation's largest known source of infections in the U.S. The roughly 400 cases there, several cities are rolling out new precautions to keep shoppers and workers safe after a handful of supermarket employees died from the virus.
It looks more like the 60,000 than the 100 to 200,000. But having said that, we better be careful that we don't say, okay, we're doing so well, we could pull back.
A growing hotspot scenario that's plaguing nursing homes and care facilities across the country.
The worsening unemployment picture is simply staggering, skyrocketing in just a month from a 50-year low to nearly 17 million seeking benefits in just the last 3 weeks. But that number is most certainly underreported.
I've tried at 1 a.m., 3 a.m., 5 a.m. I've set my alarm to try to do it at different times. I've done it right before 8 a.m. when they open, and there's just no getting through.
The problem, states don't have the staff to handle the unprecedented demand. Phone lines are jammed and websites are crashing nationwide, pumping an unprecedented $2.3 trillion to support businesses, states, and cities.
This is what the great fiscal power of the United States is for.
Kara Lunsford, the founder of Hullabaloo, an organization that supports nurses and a nurse herself, launched the survey. 82% of the nurses feel their institution is not prepared for COVID-19. 94% said they are concerned about exposing their families to the disease. A majority of the nurses surveyed said they are considering leaving their current job or quitting the industry entirely.
Doctors now trying a Hail Mary pass to save his life, a treatment called convalescent plasma, but not just any plasma. It has to come from a patient who survived coronavirus, has been better for 14 days, now tests negative with a compatible blood type.
I mean, I still want to know how this happened, because the warning signs were there. And if you don't know the answer, then how do you know it's not going to happen again?
During the first 5 days of April, more than 1,100 people were pronounced dead in their home or on the street. That's 8 times as many as last year. Since many were never tested, they're not included in the official count.
1 month ago, roughly 1,000 Americans tested positive for the coronavirus. Today, as that number surges towards 500,000, our death toll is climbing, but social distancing is saving lives. As heartbreaking images like these emerge from Americans flooding food banks that are overwhelmed and understocked, NBC News is tracking nearly 2,500 long-term care facilities in 36 states, where cases have quintupled in just 10 days. At least 2,200 have died.
Many health experts and a growing list of governors are warning the only safe way to reopen the economy is to test for exposure to the virus on a massive scale, and that's just one of 3 tools necessary. But we are nowhere near that capability.
So we're going to have a lot more testing.
We are particularly short on the test kits to be able to test for the virus.
Public health officials say there are 3 keys to reopening the economy. A diagnostic test to determine if someone currently has the virus, 2.2 million so far. An antibody test to determine if somebody's already had it and therefore might have some immunity. And contact tracing to identify anybody who's had contact with somebody who's infected. But so far, less than 1% of the population has been tested.
We need an unprecedented mobilization where government can produce these tests in the millions.
The metrics right here. That's my metrics. That's all I can do.
Mr. Trump insisting he will follow the expert advice, though widespread testing doesn't have to be a precondition.
Should Americans have to decide between staying healthy and going back to work?
Look, I think we're going to do both. We're going to go back to work and we're going to stay healthy. We're going to do testing, but you don't need to test 325 to 350 million people.
Health experts warn infection rates could soar if the economy is reopened too quickly.
His choice, but I certainly will continue, as I've always had, to give my honest assessment of the scientific and data that is really the evidence that I base my judgments on.
Google and Apple teaming up to build phone software that would alert people who'd recently had contact with someone who's infected, hoping to save critical time.
Workers in some meat plants are raising the alarm. Civil rights group Lulick says these stunning images of workers crowded together were taken inside the JBS pork plant in Marshalltown, Iowa, late last month, 2 weeks after the Trump administration announced social distancing guidelines. Some employees described to NBC News having to work shoulder to shoulder on the line. Tonight, Tyson says it's heartbroken over the deaths and will close the plant for deep cleaning.
Deaths in the UK are spiking now, approaching 1,000 a day, as high as Italy and Spain at their peak. The virus is re-emerging in parts of Asia, where it started and was largely beaten back after some social distancing measures were relaxed.
What happens if you stop paying attention to this?
In Hong Kong, the second wave is actually even bigger than the first wave. People starting to walk in the streets without any protective measures.
Flight tracker at 9 a.m. local showed a handful of planes over all of Spain, Italy, and France. Across the ocean in the United States at 9 a.m. Eastern, a very different picture.
All 50 states are now under major disaster declarations. This after the U.S. reached a new grim milestone today. More than 20,000 Americans dead by the virus. Now the highest death toll in the world.
But the number of deaths keeps climbing, now more than 8,600.
It is stabilizing at an horrific rate. These are just incredible numbers depicting incredible loss and pain.
COVID-19 infections on the rise in states such as Rhode Island, North Carolina, and Pennsylvania. Saturday, the state announcing more than 1,600 new cases and at least 70 new deaths. Even though there's no law mandating passengers must wear masks, police drag a man off a bus for not having one. Following the incident, local transport authority says it will no longer enforce the policy encouraging riders to wear masks.
Doctors in Seattle tell me they're most concerned about complacency as the situation improves and that curve flattens. They're worried that people are going to let their guard down, and therefore there'll be more cases and potentially more lives lost. Jose?
This is beyond economic. This is really, I call it the opening our country task force.
So don't let anyone get any false ideas that when we decide at a proper time when we're going to be relaxing some of the restrictions, there's no doubt you're going to see cases. I would be so surprised if we did not see cases. The question is how you respond to that.
Can't ask the people of this state or this country to choose between lives lost and dollars gained.
The angel of the Lord, the Spirit of God has spoken to me and says, don't be afraid.
Hashtag stop persecuting faith. Adding in a separate tweet, I live in Texas, where we protect public safety, but aren't authoritarian zealots. Of the 15 states with the most vulnerable populations to coronavirus, 11 of them have some kind of religious exemption.
Coronavirus relief checks are starting to land in some accounts today. When will yours arrive?
That way it goes straight to your bank account. Now, if you haven't received it yet, don't worry. They're not going out all at once, but they should be by the end of next week.
And Stephanie, with no firm date to reopen the economy, is $1,200 going to be enough?
Listen, Jose, it's not.
The death toll in the United States now spiking to more than 21,000.
We think it's going to be a virus that stalks the human race for quite a long time to come until we can all have a vaccine that will protect us.
Earlier today, Pennsylvania announced more than 1,000 new cases and more than 13 dead. Among the hardest hit, the nation's nursing homes. In Anderson, Indiana, 24 died.
Keep a safe distance of 6 feet.
Mr. Trump calls this his toughest decision. Will he lift or extend federal guidelines that expire April 30th? Document repeated early warnings in January and February inside the administration and conflicts among advisors about what action to take.
That if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that.
In Washington at the National Cathedral, ordained church leaders today taking measured steps 6 feet apart.
We're going to expand the number of people who are eligible to do the antibody test.
Nearly 2.7 million Americans have now been tested, but that's less than 1% of the overall U.S. population.
Governors in 7 eastern states and 3 western states tonight working together to map out a cautious way forward as President Trump asserts it's his call to make. From the virus in the U.S. tops 23,000. Now in the middle of it all, tragedy doubling down on parts of the South in the form of deadly tornadoes.
The worst can be over, and it is over, unless we do something reckless.
It is not going to be a light switch that we say, okay, it is now June, July, or whatever, click, the light switch goes back on.
The CDC director cautions against moving too quickly. President Trump is now insisting he has the sole power to decide how and when states reopen.
When somebody's the president of the United States, the authority is total. And that's the way it's got to be.
In fact, most legal experts say the president does not have the authority to direct states to lift their emergency orders. President Trump's retweet of a post with the hashtag #FireFauci after Dr. Fauci acknowledged more lives could have been saved if the country had been shut down earlier.
But the FDA commissioner also warning not every antibody test is accurate.
No test is 100% perfect, but what we don't want are wildly inaccurate tests.
That the number of dead is far higher than reported. Tonight, more than 3,700 additional names being added to the state's already staggering death toll that now tops 10,000.
The percentage of loss of life is getting higher in the nursing homes.
Around the country, deaths at long-term care facilities are mounting. NBC News counts 4,300 across 27 states, almost double last week's number.
The President of the United States has the authority to do what the President has the authority to do, which is very powerful. The President of the United States calls the shots.
His proclamation is that he would be king. That's what a king is. A king has total authority.
Netspend, which processed nearly $1 billion in relief so far, says most Americans are using the stimulus money on necessities like food and gas, facing the worst and fastest jobless crisis in modern American history.
Tonight, the calls to reopen parts of the nation's economy are growing louder. COVID-19 took another 752 lives in New York State, and those are only the confirmed cases.
Governor Kristi Noem says a statewide order would not have stopped the virus because the plant is an essential business.
This plant is incredibly important to our food supply in this country.
A CDC team arrived today with more than 500 employees at the processing plant having tested positive.
In less than 2 weeks, more than $305 billion in emergency loans have been approved to more than 1.4 million small businesses nationwide. The $350 billion fund could run out of money as early as tonight. President Trump's name will be printed on the front of those checks, according to the Treasury Department. The first time that's ever happened on an IRS payment. House Speaker Nancy Pelosi tonight blasting the move as shameful.
Tonight, the World Health Organization pushed back after President Trump suspended U.S. funding.
We regret the decision of the President of the United States.
Bill Gates calling it as dangerous as it sounds. China's misinformation about the virus.
It would have been so easy to be truthful. And so much death has been caused by their mistakes.
Chinese authorities secretly determined they were likely facing a pandemic on January 14th, but kept silent for 6 days. In that time, allowing massive New Year's celebrations. Chinese officials deny a cover-up.
The original antibodies to do the testing came from an unlikely pair of 80-year-old donors.
We were the poster children for the people that are supposed to succumb to COVID-19, but we never did, and we don't know why.
His remarkable recovery and the role plasma may have played is now part of a much larger study.
We are not opening all at once, but one careful step at a time.
This afternoon, telling all 50 governors, you're going to call your own shots. The White House announcing 3 phases to guide governors' decisions. Phase 1, urging all individuals when in public to maximize physical distance from others, and saying schools that are currently closed should remain closed. Phase 2, when non-essential travel can resume and bars and schools can reopen. And Phase 3, when Americans can largely return to their lives, but should consider minimizing time spent in crowded environments. President Trump indicated that the economy would have to be reopened before widespread testing can be available.
I don't think that the government really has any business telling us what we can and cannot do.
This protest in Virginia followed others this week in Michigan and North Carolina.
Authorities say they found 17 bodies crammed inside a small morgue at the state's largest nursing home.
I am also outraged that bodies of the dead were allowed to pile up in a makeshift morgue at the facility.
That facility has been reported to police before. One owner was an executive of a troubled family-run nationwide chain NBC News investigated last summer. NBC News now counts more than 5,600 deaths at more than 3,400 facilities nationwide.
More than 5 million workers filed for unemployment benefits last week, pushing the total to a catastrophic 22 million out of work in just 1 month. That's more than the populations of 48 states, including Florida and New York. The sudden unemployment surge wiping out virtually all jobs added since the financial crisis 11 years ago.
After a chaotic start, more than 14 years' worth of loans were processed in less than 14 days. But it wasn't enough.
Back now with new signs that coronavirus can have harmful effects on the body beyond the lungs, in some cases impacting the brain.
45 in a 4-week period, nearly triple the normal number, according to neurosurgeon Dr. Joanna Fifi. Half of the patients had COVID and were, on average, 12 years younger than typical stroke victims.
But so far, only 3.2 million people have been tested for COVID-19 out of 328 million Americans.
Good evening. Remember that unity and resolve to bend the curve, to stay home and save lives? It's being tested tonight.
From New Jersey to Minnesota today, new protests demanding an end to the shutdown. Today, beaches reopened in Jacksonville, Florida.
This is mayhem. We need a coordinated approach between the federal government and the states.
And new research from Stanford University suggests that the number of people infected could be up to 85 times higher than the official count. The study found that up to 4% of those tested in one California county had COVID-19 antibodies.
President Trump encouraging demonstrators using their own language, tweeting in all caps, "Liberate Michigan, Minnesota, and Virginia." All 3 battleground states have Democratic governors, and each has faced protests for their stay-at-home orders.
They seem to be protesters that like me and respect this opinion, and my opinion is the same as just about all of the governors. They all want to open. Nobody wants to stay shut, but they want to open safely. So do I.
One Democratic governor tonight calling the president's tweets unhinged, warning he's putting millions of people in danger of contracting the virus. The president also attacking New York Governor Andrew Cuomo, saying he should spend more time doing and less time complaining.
He's sitting home watching TV, maybe he should get up and go to work, right? He's sitting home watching TV, maybe he should get up and go to work, right?
Among those who did get money, the high-end steakhouse Ruth's Chris, which made $42 million in profit last year, now receiving a $20 million loan.
In a new national survey of care facilities, 70% say they're not fully prepared for COVID, and nearly half are having staffing challenges.
That included remdesivir, the experimental drug first designed to treat Ebola.
U.S. intelligence officials say it's showing no let-up in spreading something else worldwide, disinformation. Some of it comes directly from Chinese government leaders or state-run media. Claims that the virus might have been a U.S. bioweapon or a disease spread by American soldiers, or one that actually showed up first somewhere else, as in this from Chinese TV.
The coronavirus may have circulated in Italy before the outbreak in China.
While U.S. officials say it's possible that the virus could have originated in a Chinese military lab, perhaps by accident, China strongly denies it. He says that's a theory that lacks scientific proof.
The U.S. hit a new milestone today. More than 700,000 confirmed cases of coronavirus.
They opened the beach in Jacksonville, I think it was some beach in Florida, and the whole beach was filled. Yeah, because you have all this pent-up demand.
This is just grossly irresponsible, and it is dangerously bombastic because it inspires people to do dangerous things.
But the daily death toll remains high. 540 lives lost, 36 in nursing homes. The outbreak ravaging these facilities at a devastating pace.
Nursing homes, by far and away, are the #1 long-term, really devastating consequence of this disease.
Nationwide, the New York Times reports that a fifth of COVID deaths are linked to nursing homes, which have been criticized for underreporting cases.
The transfer of virus-fighting antibodies via plasma worked in past epidemics, including the 1918 flu and the SARS outbreak.
And its death rate is now far higher than its neighbors. 150 deaths for every million people, compared to 60 deaths a million in Denmark, 30 in Norway, 16 in Finland. Many are horrified at Sweden's gamble.
I'm a scientist. I don't trust authorities. I trust data.
Grim milestone for our country. The death toll today hitting 40,000. That's twice what it was just last weekend. And as cases surge, there are defiant new calls to open up communities.
Vermont and Texas to reopen some businesses as early as tomorrow. Other states, including North Dakota, Ohio, and Idaho, could begin by May 1st.
The recent news is good. We are on the other side of the plateau, and the numbers are coming down.
The virus is also exposing vulnerabilities within the Navajo Nation. The largest Native American reservation in the country has more than 1,000 positive cases.
Europe's death toll today surging past 100,000. It's now home to 60% of the world's COVID-19 deaths.
With the U.S. death toll soaring above 40,000, states like Massachusetts and Illinois are still considered hotspots. Boston and Chicago seeing a surge of infections. Amid protests today to reopen businesses, New York's governor speaking out.
Nobody disagrees that we want to get out of this situation. Nobody. You don't need protests to convince anyone in this country that we have to get back to work.
NBC News confirming more than 9,300 deaths in roughly 4,500 locations. The White House now requiring long-term care facilities to disclose deaths and cases.
Jesus is my vaccine, spray painted on the side of one truck. Protests like this one have spread across the country, in some cases organized by anti-government groups, anti-vaxxers, and gun rights activists.
But says 70% of the tests gave inconsistent results when his team tried to validate them.
These rapid test kits are dangerous.
Why do you think they're so dangerous?
Well, because they're giving false positives or false negatives. It might give people a false sense of security that they somehow have immunity.
In March, the agency loosened restrictions, allowing companies to self-validate in an effort to speed up availability. FDA Commissioner Stephen Hahn acknowledging there are questions about accuracy.
This possible second wave of relief comes after several well-known restaurant chains got tens of millions of dollars from the loan program, including Ruth's Chris Steakhouse, Potbelly, and Shake Shack. They used this exception for restaurants, allowing them to apply because they had less than 500 workers per location. In Florida, nearly 650,000 verified claims were filed. Only 40,000 have been paid.
Oil prices turned negative for the first time ever. What does that mean?
Lester, that means there's an oversupply of oil right now as all of us stay home and economies are at a virtual halt.
A similar situation in Iowa, where authorities say 2/3 of new cases on Sunday were linked to meat plants.
Vaccines normally take 10 to 15 years to produce, but researchers think they could have a COVID-19 vaccine for widespread rollout in 12 to 18 months. The Emory trial uses the genetic material from the virus to isolate one of its proteins. The body then uses that protein to stimulate an immune response. Worldwide, there are dozens of vaccine candidates, with 2 clinical trials underway in the U.S., including the Emory trial.
Starting late next week, most Tennessee businesses will be free to open their doors, some as soon as Monday. With the number of COVID-19 cases nationwide closing in on 800,000.
If you want to live, you stay home. My God, don't open up this country.
Each day, the U.S. is conducting about 45 diagnostic tests for every 100,000 people. To safely reopen, Harvard researchers estimate the country needs to do more than 3 times that. Today, the FDA approved the first in-home test for coronavirus, which will initially be made available to healthcare workers. Largest study so far, the malaria drug hydroxychloroquine, found no benefit in treating coronavirus at U.S. veterans hospitals. Researchers also reported more deaths among patients who got the drug compared to those given standard care.
At grocery stores nationwide, at least 15 employees have died, and another 2,200 have contracted the coronavirus.
The reports that came out, and we don't know. We don't know. I've had a very good relationship with him. I wouldn't, I can only say this. I wish him well.
Georgia is divided. Today, the state hit a new milestone, topping 20,000 confirmed cases. More than 800 have died.
I told the governor of Georgia, Brian Kemp, that I disagree strongly with his decision to open certain facilities.
So you don't believe there should be any social distancing? You don't believe that this is
Of course I believe there should be. Of course. How
do you do that in a casino?
That's up to them to figure out. I don't own a casino.
Declaring the virus was perhaps present as early as December.
First known pets to become infected in this country, 2 cats testing positive for the virus.
And news late today that 8 lions and tigers at the Bronx Zoo have now tested positive for coronavirus.
This time, the government is carving out $60 billion for smaller lenders, hoping to reach the smallest borrowers. Hundreds of thousands of small businesses were squeezed out by larger companies who received millions because of an exception allowing businesses with fewer than 500 employees per location to qualify.
Since mid-March, 911 calls for heart attacks are down 25%. Calls for strokes down 20%.
We do believe that people are staying home, not coming to the hospital with their suspected heart attack or stroke.
The death toll still inching upward, now over 48,000. But at the same time, unemployment numbers have risen to numbers worse than the Great Depression.
This Smithfield Foods plant in Sioux Falls has gone dark after more than 800 workers tested positive. And now, New York Governor Andrew Cuomo is launching an investigation into nursing homes. NBC News has found nearly 11,000 deaths in nursing homes nationwide are linked to coronavirus.
They get paid to take care of a resident, and if they don't, we will take appropriate action.
Nevada has more than 4,000 confirmed cases of coronavirus and fewer than 200 deaths.
But hasn't it been because of social distancing that the numbers have been what they are?
How do you know until we have a control group? We offered to be a control group.
You're offering the citizens of Las Vegas to be a control group to see if your theory on social distancing works or doesn't work.
Wrong. Absolutely wrong. Don't put words in my mouth.
You just said we'll be a control group.
Excuse me. What I said was I offered to be a control group, and I was told by our statistician, you can't do that. We would love to be that placebo side so you have something to measure against.
More than 26 million jobless claims have been filed since March. And it's hitting low-income workers especially hard. More than half say they or someone in their household lost a job or has taken a pay cut.
Nearly 14% of the 3,000 residents randomly tested had COVID-19 antibodies, meaning they had the virus. With nearly 20 million people in the state, some 2.7 million New Yorkers may have already been infected.
They had the virus, they developed the antibodies, and they are now, quote unquote, recovered.
Now, if we have pockets, a little pocket here, then we're going to have it put out. It goes out, and it's going to go out fast. We're going to be watching for it. But it's all possible. It's also possible it doesn't come back at all.
We will have coronavirus in the fall. I am convinced of that.
The number of people dying of COVID-19 passing the 50,000 mark. Also today, Georgia, Oklahoma, and Alaska becoming the first states to lower their guard against coronavirus in a big way.
Elsewhere, calls to lift lockdowns are growing louder, including people taking to the streets in Wisconsin. Though a new poll suggests many Americans are concerned about moving too fast. 80% say if restrictions were lifted tomorrow, they are unlikely to go to places that draw crowds.
President Trump tonight now says he wasn't being serious when he suggested multiple times Thursday that scientists should consider exposing the body to sunlight and disinfectants as potential coronavirus cures.
I was asking a question sarcastically to reporters like you just to see what would happen. So supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light. And I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that, too. Sounds interesting.
The president also asked if there's a way to use disinfectants inside the body.
Then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number in the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with.
Dr. Deborah Birx's reaction caught on camera. Top administration officials tell NBC News members of the president's coronavirus task force were shocked by those comments. They say he apparently misinterpreted scientific information discussed with him before Thursday's briefing. The president's remarks widely condemned by medical experts. He spent weeks hyping hydroxychloroquine pills as a potential coronavirus miracle drug, despite a lack of clinical evidence.
We're sending them to the hospitals. We're sending them all over. I just think it's something, the expression, I've used it for certain reasons. What do you have to lose?
The FDA today issuing new guidance warning that people should not take chloroquine or hydroxychloroquine to treat coronavirus outside of hospital settings or clinical trials, citing reports of serious heart rhythm problems.
Now they're banking on the second round of the Paycheck Protection Program. Today, an additional $310 billion was pumped into the fund. But there's concern that new money may be quickly tapped out because of the volume of applications left over from the first round. Some banks have no plans to accept new applications.
More than 53,000 Americans have died from the virus. But then there is this. More than 26 million have lost their jobs.
Meanwhile, other coronavirus hotspots continue to flare up across the country. Illinois, Pennsylvania, and the tri-state still recording a high number of infections. In the nation's epicenter, Governor Andrew Cuomo says numbers are close to what they were 3 weeks ago, and they're doubling the diagnostic testing capacity to 40,000 a day while expanding the eligibility.
First responders, healthcare workers, and essential employees. Why? Because these people have been carrying the load.
After officials tied 90% of the county's nearly 800 COVID cases to the single meat processing plant. The Waterloo plant joining a growing list of others in 8 states, shut down by beef, pork, and poultry companies trying to contain virus outbreaks.
And warning from the Lysol brand. Under no circumstances should these chemicals be ingested. The president said he was misunderstood.
But I was asking a very sarcastic question.
I would suggest the media not take him out of context.
A pretty stunning announcement today from the World Health Organization, now saying there's no evidence that COVID-19 survivors are immune from getting it again?
Yeah.
Even in Westport, Connecticut, police were set to deploy a drone that could monitor people's temperatures.
About a third of all states are planning to loosen restrictions on movement and businesses this week. The number of cases of coronavirus across the country is still growing. This weekend, approaching a disturbing milestone with nearly 1 million cases now.
It's called telemedicine, virtual visits on computers, even smartphones. It's not new, but the advancement and availability of technology has pushed it into overdrive.
Also announcing they're lifting lockdowns, Iowa and Colorado, now joining 8 other states starting to reopen. None have met recommended White House guidelines for a 2-week decline in cases.
With nearly 1 million confirmed coronavirus cases in this country, the death toll is set to soon surpass 60,000.
Tonight, signs that a critical link in the nation's food supply chain might be cracking, as some meat processing plants around the country have become COVID-19 hotspots.
Is still desperate for federal help. A second round of emergency funding opened today with another $310 billion in loans being made available.
Yes, the World Health Organization now says we expect that most people who are infected with COVID-19 will develop an antibody response. What we don't yet know is the level of protection or how long it will last.
Sweden has more deaths than its neighbors, but says its is a long-term solution with little economic impact and its education and healthcare system intact.
Tonight, over 1 million confirmed cases in America. The pandemic has now killed more Americans than the Vietnam War.
President Trump is invoking the Defense Production Act, ordering all beef, chicken, pork, and egg facilities to stay open, declaring them critical infrastructure.
We always work with the farmers. There's plenty of supply. There's plenty of, as you know, there's plenty of supply. It's distribution, and we will probably have that today solved. It was a very unique circumstance because of liability.
The president's executive order will also send more protective gear for employees at meat plants.
Lines down the street this morning at City MD clinics in New York for a new blood test that looks for the presence of an antibody that builds up as a person recovers from COVID-19. Results come back in a day or two and will be shared with public health officials to help them track the virus.
A group of scientists at the UK's Oxford University says a vaccine could be closer than has been predicted. Maybe even ready this year.
Reveals 49 malls and outlets across the country will begin opening Friday. Technical issues dealt another crushing blow to many of the small business owners trying to get a piece of the $310 billion up for grabs.
The vice president is on defense after visiting the Mayo Clinic and not wearing a mask, despite the clinic's guidelines that all patients and visitors wear masks. He was apparently the only person there without one. The vice president explained his decision by saying he's tested regularly and negative for coronavirus. He also said not wearing a mask allowed him to thank healthcare workers and, quote, look them in the eye. The Mayo Clinic said it had shared its policy with the vice president's office. Earlier this month, President Trump announced new CDC guidelines recommending wearing a face covering in public when social distancing isn't possible. But Mr. Trump said he didn't plan to do so.
Get word of the first family dog in America to test positive.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important.
The drug is remdesivir, made by Gilead Sciences. The preliminary NIH data showed remdesivir cut the recovery time in the hospital from 15 to 11 days. The mortality rate also dropped, though not dramatically, from 11.6% for those on the placebo to 8% for those on remdesivir.
In the age of social distancing, it was a shocking sight. Thousands of mourners in Brooklyn at a rabbi's funeral.
You are putting my cops' lives at risk, and it's unacceptable.
New York City Mayor Bill de Blasio says he's instructing the NYPD to cite or arrest anyone who disobeys his social distancing orders. The death toll here at the epicenter is still topping 300 every day.
By Friday, at least 20 states will lift many mandates, though restrictions remain widely in place. None have met the White House guidelines calling for a 14-day drop in coronavirus cases.
With more than 5,000 workers impacted by COVID-19, unions are demanding protections, including more testing.
New Harvard study shows the country needs 5 million tests a day to reopen safely.
Well, we're going to be there very soon.
But his own top official overseeing testing strategy told Time magazine in an interview released late last night, there is absolutely no way on Earth, on this planet or any other planet, that we can do 20 million tests a day or even 5 million tests a day. Today, the president tried to walk back his comments from yesterday.
I didn't say it. I didn't say it, but somebody came out with a report saying 5 million. I think that was from the Harvard report. But we are going to be there at a certain point. We'll be there.
Currently, just over 200,000 tests are performed a day.
The federal government rose to the challenge, and this is a great success story. And I think that's really, what needs to be told.
Those comments coming against the backdrop of a death toll now at more than 60,000.
When you cancel elective surgeries, hospitals feel a financial pinch.
New numbers reveal a devastating side effect of COVID-19 on hospitals. In the first quarter of the year, half of the loss in the nation's GDP came from the healthcare industry. In the month of March alone, 43,000 healthcare workers lost their jobs.
Stay-at-home guidelines are set to expire. A go-your-own-way approach is rapidly taking hold across the country.
The homeless asleep on trains.
Let's clean, disinfect those trucks, those buses and trains every 24 hours. Why? Because that's the way we best protect the health of our essential workers.
With the national death toll climbing over 60,000, the state-by-state approach to reopening night and day.
Now there are new questions about whether their jobs could soon be on the line without help from the federal government.
The state has a $13 billion deficit. They have provided us nothing. Nothing for police, nothing for firefighters.
Across the country, state and local governments are facing crushing budget shortfalls due to cratering tax revenues. One report estimates states will be short more than $200 billion over the next fiscal year. 21 states would have to fill budget gaps of at least 10%.